Welcome back to the Michigan Business Beat, brought to you on the Michigan Business Network. I'm Chris Holman, and we've got some very important information today. It's going to answer a lot of questions, especially if you're in mid-Michigan here. We have John Foren with us right now, Director of Media Relations and Corporate Communications at Sparrow Health Systems. And John, you guys have been the big news, what they call, stories with legs. They hang around, and there's a lot of ancillary stuff that needs to be answered. And we're going to do that here today. Welcome to the show, John. Good to see you.
Nice to see you. How you doing, man?
I'm doing better than I deserve, that's for sure. So let's talk a little bit about this merger with U of M, and I won't call it a merger because we're going to clarify that in a minute. But why is Sparrow joining the University of Michigan?
Well, we've had a partnership with U of M Health since 2019 at our Children's Center. Officially, our Children's Center is called University of Michigan Health at Sparrow Children's Center, and that has worked out really well. We've used U of M specialists. They've been incredible. The two organizations have really come together. So kind of from that relationship, we started talking about more. What else can we do? And we realized we had kind of a common ground. Our visions were very similar. So this is the result of several years of discussions, really. It's kind of a natural evolution for us. Basically, we're joining this nationally renowned system, and they've committed $800 million in capital investments in Sparrow. That'll be through hospital operations and strategic investments over the years. That's going to allow us to do so much. It's going to allow us to expand services, build our strength, our bench strength and our top line strength with clinical expertise, get leading edge technology. For U of M, so that's what Sparrow's getting. For U of M, Sparrow is going to be a linchpin in a statewide network of care. Much like some other health systems are doing throughout the country. U of M does not have, it's an academic research center, really. Certainly, if not the top, but the top health system in the state. But they don't have a clinical network, for instance, similar to our Sparrow Medical Group of practices. So that's what they're looking for Sparrow to help with. We have expertise in that through Sparrow Medical Group. So the idea is that we will help them branch out into a clinical network statewide.
So, John, what kind of changes can we expect for the Sparrow image and brand, and will it be a change of name or logo or anything like that?
Well, that's a good question. I get that question a lot, especially from my MSU friends. First off, we have a brand that, we've built over 126 years, and we're very careful about that brand. Sparrow has a certain cachet in mid-Michigan and really statewide and nationwide. So whatever we do, we have to protect that brand. But as we've done with the Children's Center initiative, we've co-branded with them. We're proud to use the U of M Health brand, which really stands for the highest degree of expertise. So in the coming year, we're going to work with U of M to basically come up with a joint strategy. I know that's kind of a vague answer, but that's kind of in the offing. We can't do anything along those lines until this partnership gets final regulatory approval, which we hope we will get by the end of the second quarter, if not sooner. But for the time being, the plan is to come up with a long-term Sparrow strategy kind of within the context of the U of M Health brand. So you're going to see probably some kind of mixture of the two.
So, John, why do we say Sparrow is joining U of M Health rather than affiliating, acquired, or bought, or whatever?
So that's a good question. That's another one, especially our caregivers have asked about. And we've seen various descriptions in the media of, U of M Health purchasing Sparrow, buying Sparrow, so on and so forth. It's not really an acquisition or purchase per se, because basically we entered into negotiations with the U of M to join together. To affiliation is used in some of the legal documents, but even that's not a great descriptor. Basically, we are joining the U of M Health Network on our own volition. It's not like a purchase where somebody says, I'm buying you, we're two not-for-profit organizations. Basically, we're coming together into a statewide system. And to say otherwise, to say like acquire or purchase, kind of implies that we didn't have a choice in the matter. And this was certainly born of talks between the two of us for several years.
John, we got about literally 15 seconds left. Is this going to change the relationship with MSU or any other affiliates at this point?
We hope not. We value MSU, our MSU relationship. We've had a longstanding relationship. We hope to continue it and our training programs with MSU.
Well, thanks so much for taking time to clarify a lot of stuff. John Foren, the Director of Media Relations, Corporate Communications at Sparrow Health System, on the new affiliation with U of M Health. Thanks, John. Appreciate you being with us.
Thanks, Chris.
We're going to be right back on the Michigan Business Beat. I'm Chris Holman on the Michigan Business Network.